Welcome to the Beyond the Vines podcast, where I interview local business owners in Sonoma County to highlight small business and grow our community. I'm your host, Amy Ehlers, a mom, realtor, and Sonoma County native, and I'm excited to connect you to some amazing people in this beautiful area that we call home. Welcome back to the Beyond the Vines podcast. Again, thank you so much for listening. Please be sure to like and subscribe if you are enjoying this. It's so helpful to the small businesses that are on the podcast to have you following them, and I'm so grateful for you. I am back today with the owners of Santa Rosa Dentistry. They are located conveniently between Montgomery Village and downtown Santa Rosa. What I find so interesting and love is that they serve patients of all ages, which is great when you've got families and you've got yourself and your kids that need to come in, and I'm really excited to learn more about that. So welcome today, ladies. Thank you so much for coming.
Thank you for having us.
I would love for you to introduce yourselves and tell us a little bit more about yourselves and how you got started.
Sure. I'm Laura Ellefson, and I grew up in Santa Rosa. And decided to go to dental school. I found my way eventually to Tufts Dental School and loved it. And that's where I met Kasia. She and I were in the same class.
That's amazing.
And here we are.
So you both met at Tufts in Boston.
Yes.
That's amazing. Okay, and then you ended up here. I want to hear more about your story.
Oh, goodness. So I was born in Poland and came to the U.S. at the age of 15. So straight into high school, talk about puberty and growing up and having a whole life change.
All at the same time.
All at the same time. So it was a lot.
That's a lot.
But it allowed me to kind of discover myself a lot and kind of go into okay, what do I want to do? So then in college, I ended up doing, I was a math major.
Wow.
Yeah. So I was very analytical and I like kind of having processes and knowing what the answers are. And then I was a studio art minor. So combining everything kind of led me into dentistry.
Amazing.
Because I always wanted to work with people. I wanted to be in healthcare.
Yeah.
So then, went to Tufts Dental and met Laura.
I love that that's where you met and that your friendship started there. It's not like you just were, in the same field and you were working in the same office. So take me from there. So you met, you graduated together.
We became friends at Tufts. And we graduated. We didn't know that we were going to end up together in the same town, though. I was getting married later that summer to my husband, Tom, and she was moving out to California.
With my current husband.
Amazing.
We were just dating at the time, but I was going to do a general dentistry residency at the VA in Palo Alto, so that's why I moved to California, and he followed me, and that's where we started in California, and that's where we lived. Well, Laura was actually in Colorado.
So you made a pit stop in Colorado.
I did.
Before you came here.
I wanted to come back to California originally, but Tom's job, he got a relocation to Louisville, Colorado, which was great in the end.
Yeah.
It was a bit of a challenge finding a job right out of dental school.
I'm sure.
But I worked at Dental Aid. So a nonprofit.
Great.
Dental office, got my hands wet, and it was a great learning experience. And there were a lot of children there.
That's amazing.
So that's where I developed more pediatric skills, or at least a more compassion for it. But no, I did have fun with it. I worked with a great pediatric office, a dentist while I was there.
Great.
So I learned a lot. And then after 4 years, was able to move back to California to Santa Rosa. So around this time,
we were looking to move out of the San Jose kind of Silicon Valley area, and with Laura's recommendation, she showed us the area, and she said, Petaluma is a really cute town. Why don't you check it out? And so we decided to move to Petaluma.
Oh, I love this.
Yeah. At that time, my son, so my firstborn was 6 months old. So we're like, okay, we need a family area to live in, family friendly. Petaluma ended up being great.
Yes.
But once we moved, I needed to work somewhere. So I started applying for dental jobs to work with, an older dentist, and got hired at our current office.
Amazing.
Yes. So I started working there, and literally 2 days later, she called me. And then
saying, guess what? I'm ready to move back to Santa Rosa. How's it going on your end?
So
What's
cool.
new? And she told me she just found a job. I was like,
Wow.
really? With who? I probably know the guy. Yep, sure enough, that was my family practice that I was a patient there.
That's incredible.
Already since I was 16. So it was a small world, but inside I'm thinking, oh, great, she took my job. So I'm going to start from scratch again here. All right.
Yeah.
But just still, I emailed the dentist, the owner, and told him, I'm going to be moving back. I already heard you hired Kasia. Great choice. Hope it works out well.
Her.
But do you know anybody else who might be looking for an associate dentist? But in the end, he actually hired us both.
That's
so he took me on
incredible.
board too. And that worked out really well, obviously, in the end.
Yes.
But at the time, even, she had a new baby working part-time. He still wanted to work too, so we were all three of us taking part-time 2-3 days a week. So it worked out great.
It worked out really great.
What a good workflow to be able to do that and to already have the rapport that you had with each other and then with him. And so I think that's amazing.
Yeah.
So, and I'm also glad you guys made this move out here, and otherwise we wouldn't know your son. That's how you and I know each other is mom life. So wonderful. So when did you take over Santa Rosa Dentistry, and how did that play out?
After about a year,
okay.
I came aboard. She had been there already for about 6 months before me. I came in that fall of 2016. We were associates for almost a full year when he approached us with the offer to buy.
Wow.
So this is in the spring of 2017 now. And it took, that takes us several months. So we became owners August, officially.
That's incredible.
17.
Yeah. And my daughter was 2 months old at the time.
I just like to do it all at once.
All at once, jump in.
Yeah. Were you excited to be co-owning it together? Was there any concerns or worries, or you guys were such a good team already?
I think we felt confident in knowing that we were trained together, learning the same things, the same philosophy of dentistry, how to approach, and being friends already, knowing that I think there wasn't any hesitation on my end.
We
felt
have
like
the
it was
same
natural.
values, so it wasn't, at no point do we ever argue no, we should do this or this, that. We value the same things, we want the same things. So it's like a perfect partner.
That's beautiful. Yeah, no, truly.
But, we both have kids and being business owners and dentists, we help each other.
Yeah.
Laura had 2 children during the ownership since we've acquired the practice, and so she had to take a few months off.
Of course, yeah.
So I was there. She was there when we acquired the practice, and I was still on maternity leave. And she never said, "You need to come back now."
Help me.
She was like, "You stay on maternity leave.
That's
You're
amazing.
Fine. Stay, enjoy your baby."
What a beautiful partnership that is. That's the ideal situation.
We're very lucky.
Yeah.
Well, and
it's
also
unique.
your patients are lucky because I'm sure that trickles right down to them. That same values that you hold and the way that you are with each other, I'm sure is reflected in your practice. So that's amazing. Beautiful.
Thank you.
Wonderful. What are some challenges you've faced?
Since the opening, I think we can all kind of remember 2017 and relate to the Tubbs fire. That was the first big one that hit us, and a lot of our patients lost their homes that year. So being new business owners, now responsible for our team members and our patients, and trying to figure out how to navigate that stress. That was one of the first big challenges. And then as that calmed down, then the COVID happened. And that was also another, all of our blood pressures raised during that one.
I can't even imagine with dentistry. You're in people's mouths. There's a lot to figure out there. Yeah.
But what really helped with that was our partnership and helping each other. And our team members have been great. Everybody from the front office, our assistants and hygienists, everybody rallied together. There wasn't any added stress of... there weren't any complaints from them anyway. At least that's what we heard.
Not that you heard. No.
They really tried, and they were
amazing.
very patient with us as we were learning the ropes of how to manage. So
much unknown during that time that you, I'm sure, had to figure out, just go with the flow of things,
Right.
So that's definitely a challenge. I know you serve patients of all ages, which I find is really interesting, and because it's not a separate pediatric. It's can a whole family come to your practice essentially?
Whole family.
I love that.
Grandparents to babies.
I love that. I love that.
We have patients as young as 1-year-old and
Wow.
as old as 100.
103 might have been our lowest.
Wow.
Yes.
So the age range is 1 to 103. All right. That's
currently.
pretty unique. Like, very unique. How does that work? Do you divide, like, does one of you do pediatric and one of you does adult, or do you both do both, or how does that all work?
I tend to be more comfortable with the pediatric population, at least initially. Not that Kasia is perfectly capable, but I had more experience in my in my training years at Dental Aid, so just learning from that pediatric dentist, I am perfectly comfortable at least having the initial exam with the child, trying to see if we can try maybe something really easy to start with, like sealants. How does the child handle that? Do we need to do a lot of behavior modification training, or does the child just need a lot of dental work? Unfortunately, that is out there where kids do have a lot of decay. And I did see a child just in the last couple weeks who I did have to refer to pediatric office. Because I just didn't feel comfortable. Sometimes kids do need specialized care, and it's in their best interest to refer. But most of the kids that we see, they're children of their parents who are who are children of our adult patients.
Yes, there we go.
Perfect. So they do come together as a family. It's usually the parents come in first. They have their exam and they ask, "Do you see children? Can I bring in my 5-year-old?" And I say, "Sure." So that kind of starts the family dentistry part of it.
I love that.
And it works out really well. It's convenient for them to schedule. The parents come in for their cleaning at the same time. Looking at the
very
child.
Convenient.
So we can schedule them either back to back or side by side on the schedule. It really helps them out.
Yeah, that's wonderful. And do you feel like I imagine you can kind of stay with these patients for a long time, because you can maybe start when they're, 1 and then be with them through adulthood,
Watch
which is
them grow up.
Special. Yeah, that's amazing when you think about it. So that's great.
We've been at that practice for 7 years now.
That's amazing.
And it's actually amazing to see these kids who started as 5-year-olds and now they're becoming teenagers.
Oh, I can't.
They're getting their braces off. They're going to high school, and we do have photos of on the patient charts of the children. So we see these children as 4 or 5-year-olds, and now they walk in,
totally
not looking anything like their photo. So it's time for an update.
That's funny. Well, especially because you probably see them every 6 months, I would guess, right? So it's a total, especially at that age, the change in the kids is total, drastic.
I recently had a patient come in, and I look in the schedule, and I'm like, oh, I know who I'm seeing. I remember the face, and I walk in the room, like, no, this is not the right person. It's 3 years later,
That's amazing.
Because sometimes I'll see the patient every 6 months, but sometimes the patient will come in and see Laura for a few years just because of how the schedule worked out. And then 3 years later, I'm seeing the patient, and oh my goodness, you grew up.
That's amazing. Gosh, that's really special, though, that you get to be a part of that. So, are there any new technologies or techniques that you've incorporated into your practice that really enhance your patient's care?
We have.
You look proud of it. I'm excited to hear.
We
about
are very
this.
proud of
it.
We've acquired a practice that's been around since 1970. So there's a lot of updates to do, and we're slowly introducing them. But the biggest one that we did in the last, I think, year and a half now, is we have a digital scanner.
Oh.
And so it's changed things tremendously, because what it does is it's a wand that goes in your mouth, and it takes 300 pictures in a matter of seconds, right? And we can do an entire arch, and then it does a rendering of it, and it becomes a 3D model that is virtual.
That's incredible.
And we can literally it's like a touch screen, and we can just turn it around, we can zoom in. And so the amazing thing is that when we do it on patients during their hygiene appointments, like you come in for a cleaning, the hygienist will scan you, we can show you your teeth.
Wow.
Right? So we don't have to tell you have a broken tooth, and you're thinking, but where? I'm like, no, right here. And this is what it looks like.
Oh, that's amazing.
Or if we say your filling is falling apart, we don't have to explain it to you. We can just show it to you. And I think it's very empowering to patients because there is a built-in trust of, the dentist is not just telling me something. You know, I've seen it. It's there.
Yeah.
It needs to be taken care of. So I think patients kind of get more control over what's happening. But the other nice thing is we no longer use the goopy material. Like, I don't know if you've ever had impressions for like a night guard or whitening trays.
Right.
None of that.
Because you can do that with the technology now? Wow, that's incredible.
You can send those impressions. We take a scan of the tooth that needs a crown and send that digitally to the lab.
That's incredible.
Yeah. Yeah.
Wow. How long does the wand take? Like, how does that work? And how, like, do you have to sit within your mouth for a long time?
We have a hygienist who can do it in like under 3 minutes.
Wow.
Yeah.
Oh, cool.
Yeah.
That's incredible.
Yeah. Most of our hygienists and assistant can do it in under 5.
Wow.
Yeah. Unless, you have a small mouth or there's some difficulty.
Yeah.
But, definitely under, 6 minutes is definitely achievable. So it's very quick.
Yeah.
It's extremely accurate. Crowns fit amazingly ever since we started using it because there's no distortions in material. But it's just an amazing educational tool. We actually got it because I do Invisalign and it works with Invisalign, so we can just scan the patient and
that's
send
amazing.
and design all the trays. Yeah.
Great.
Yeah.
That is so cool that you can offer that to your patients too, because it, again, gives them the power, but also better service as well. So that's amazing.
Yeah. And then if we take it every year, it has a time-lapse feature, so we can do a comparison like what things look like. Like today compared to last year, if there's anything that's changing, we can show you, like, hey, your gums are receding, or your tooth broke, your tooth is wearing down, things like that. And, patients will be like, well, do you think my gums receded more? I'm like, I don't, but like visually, I can't tell you.
Totally.
Like, I saw you a year ago, and is there a millimeter change? I don't know. But the scanner will
they can
show
look at the
you.
scanner.
Yeah, so it's all digital record now, and it's amazing.
That is so cool. That is really impressive that you have that, and that even exists is really, I love hearing, this is part of what I love, is like hearing all the different industries, all the cool things that you guys can share. So it's amazing. I know, like, for many people, there's a fear of going to the dentist. For me, I'm not fearful, but I don't love it. I'm not excited to go. That's okay. I'm kind of like, one more thing on the to-do list. Right. So how do you work with patients that do have more of an extreme anxiety?
We are very friendly from the get-go.
I can tell.
Front office. We try to, actually, it's one of the first questions we ask patients when they call to make an appointment. There's a scale of 1 to 5. How anxious are you? And that way we can be better prepared. If they put down a 5 saying they're very, very anxious, then we will do anything we can and ask specifically, what can we do to make you more comfortable? Is it laughing gas? Is it just even listening to music while we work? We do offer headphones so they can plug into the TV, or they can bring in their own phone and headphones too to listen to music. We have a back massage feature on the chairs.
Oh,
warm blankets, so you can feel cozy and snug. The laughing gas is really the best thing. From little kids, it's safe.
Definitely.
Patients with anxiety, any adult with anxiety who just want to take the edge off. That really helps.
Wow, this is sounding kind of relaxing. So you can get laughing gas and snuggle up with a blanket and a massage.
Yes.
All right. Okay. This isn't sounding too rough, guys.
No. That's
wonderful.
We do take time to kind of figure out what makes you nervous. A lot of times it's just not understanding what's happening. So we'll explain it. We'll show you on the scanner.
Great point.
This is what's happening. This is what we're going to be doing. Some patients want to be told what's happening step by step, and some patients just don't.
Right.
So we try to know what you need to be more comfortable and go with it.
That's wonderful. Yeah. And then do you have, like, I remember my kids, I hope I don't embarrass them by saying this, but like mine were like the screamers at their first pediatric appointment. They're so good now. But I remember being like, I feel bad for all the other patients here that have to hear this. Do you have a lot of that, or is it just my kids?
It really depends. We do have, the babies, any child under 3 is going to cry and scream, really. That's so normal and common. And the adults who are nearby, anybody who in the office can hear that, they understand. We don't, I think they understand this is a very, very young child who might be coming to the dentist for the first time. And I don't think it I haven't heard of an adult patient becoming more nervous because of that.
Right.
Because we do explain, this is just a young baby. This is their first time. I'm only looking in their mouth. I promise. There's nothing else going on.
Totally.
The older children, if there's a lot of nervousness, if they're just unable to be calmed after several visits, I might talk with the parents at that point about if laughing gas isn't working, if that's not enough and they're just not opening their mouths for me, or if there's any other kind of uncooperation that needs a heavier skill set, then we might be talking about a referral to pediatric office.
That makes sense. Okay. Have you ever been bit? I just got to know.
No.
You have? Okay. What? I can imagine.
No, I haven't.
You haven't been bit?
Not hard. Not hard.
Yesterday I wasn't.
Really?
Oh, well, that's a good day then. That's how you make it through the day.
It's always a good day.
Today.
It's never like to a point where it hurts.
Right,
but like
good.
Frequently where patients will suddenly close. I'm like, don't bite me. That's my finger.
Oh, that does happen. I wasn't really counting that. Nobody clamped down and broke skin. No, but yes, I do have to remind people that my fingers are there.
My fingers are in your mouth. It's probably like a reaction, I assume, huh?
Yeah,
I don't think I've ever bit my dentist, though. Yeah. That's wonderful. So dental care can be pretty expensive, and I know, do you have a lot of patients that have insurance or don't have insurance? I know there's some changes with some big insurance companies right now. How does that come into play in the office?
It is a mix. We have a mix of plenty of patients with insurance and those who don't. And to try to make it more affordable, we have payment plans.
Okay,
and there's external financing like care credit.
Oh.
We ask the patient, what can we do first to make it easier for you?
Great.
And we have various options that they can choose from. We are thinking about a membership plan.
Oh, that's
to
a
really
great
help.
idea. Yeah.
So that isn't ready yet, but hopefully within the next few months, we'll have something in play that patients can select.
Yeah.
That's a great way to kind of, because I know it is changing for everybody.
It
a lot of insurance companies
right now.
We are out of network for most insurance companies. So we can still send claims, and patients do get a bit of a refund back.
Right, but not going to be the entire, I assume.
Not the entire.
Right. Yep. Yeah, it's great that you're figuring out a workaround for that makes it still comfortable for your patients to be able to.
We want patients to stay healthy.
Yes,
and to make it affordable.
Exactly. It's so important. It's so important. So, which kind of leads me to my next question is, what role does preventative care play in maintaining good health in general, not just your mouth? I know it does affect your whole body. So, I'm curious about that and how patients can really best understand what they need to be doing to keep themselves healthy.
Wow.
It's a long question.
We're all about prevention. We're all about educating patients, inspiring them to kind of take control, right? Because a lot of patients will be like, well, I have bad teeth.
Yeah.
Well, what can we do about those?
Right.
We're not going to tell you, no, you don't have bad teeth, but there is things you can do that will prevent cavities for you. And let's figure out what it is that you're doing or not doing, right? That maybe we can make changes so that you stop getting cavities.
Right.
So we talk to patients a lot about, what are you drinking throughout the day? What are you eating? What's your diet? What are you doing? But also, are you flossing? Are you brushing? Right? We do our little lecture for everybody that you should be flossing and brushing. But we do focus a lot on prevention, spend a lot of time with that. And it's super important, right? Because we have, if you get periodontal disease, it can affect your entire body.
Absolutely.
If you're diabetic, your blood sugar levels are going to be poorly controlled because you have bacteria in your mouth.
Wow.
Right? It affects the entire system and affects your cardiovascular health as well. So we do focus a lot on it. It's important.
Yeah, educating the patients so they understand that connection. It's periodontitis and gingivitis are both diseases of inflammation.
Right.
So is diabetes and heart disease. So they go hand in hand. When the body is stressed, trying to fight one infection, it can't manage something else going on very well.
Right.
So that's really a concept that's even dentists, even the professional community are still understanding and researching because it's fascinating but important and critical.
Yeah. I'm fascinated by that. Just as an outsider, I think it's so amazing the tie, and how important it is. I think that's incredible. So, it's good that taking that preventative measure, like you were saying, and definitely educating your patients on that. So that they're not having to come in and do anything major.
Hopefully not.
I always keep telling patients that, like, my biggest goal, we have 5 operatories, and 2 of them are hygiene dedicated.
Great.
So that's the 2 rooms where every patient's getting their cleanings. I always tell patients I want 4 rooms to just be hygiene and just 1 room for me.
I love that.
Because I want everybody to be healthy, just coming in every 6 months, having their fun appointment with the hygienist, a little conversation about their life and their past 6 months, and then see me once in a while when they need it. That's the goal.
That's the goal. I think that's really, I love that. I love that, like, view of it. Also, it sounds like your office is big.
It does sound like it's big. We actually recently toured a really big office.
Oh,
so
really?
we know what a big office looks like now. I would say we're medium sized.
Yeah,
we do have 5 chairs. So it might feel big, but it's actually cozy once you walk in. It doesn't feel intimidating.
Great.
Our front office looks more like a living room.
Oh, that's great. Yeah. That's a really great way to approach it. So, do you have any success stories or, like, interesting cases that you'd want to share? Like, any patients that came in, and really needed some help?
I did see a lady probably a couple years ago who came in, and she knew right away that she wanted to have all of her teeth extracted, taken out, and have dentures. She knew what she wanted. And usually when we hear this, we're thinking, oh, yeah, I know that's what you think you want, but it's really not an easy road. Let's see if there's any way to save your teeth. And after doing her exam, and we didn't have the scanner yet, the digital scanner. So we did take impressions and made models so I can really see how her teeth were coming together. It was the best thing to do in the end to extract. So she was happy to hear that.
Great.
Okay, great.
Yeah.
I tried to save your teeth, but you're right. We can't. This isn't going to work. So we ended up making having 2 implants in her lower jaw that an oral surgeon helped us with, and I made a denture that could snap onto those 2 implants. So it's still removable, but it snaps in, so that way it's not moving around, rattling. She can chew more, solidly without any distraction of a denture falling out of her mouth. And she was so happy in the end. It was really nice working with her. She was very pleasant to work with. It was just a rewarding journey, seeing her be transformed from teeth falling out, being, rotting away in her mouth, to having something functional and pretty that she could just, her confidence boost. She was smiling at her before and after photo. There was a tremendous change in her face.
That's incredible.
When she smiled.
Because of the way she felt about herself, I'm sure. Yeah.
Yes.
That's amazing. Yeah. Definitely, like, a story to be so proud of what you do. And, it's not just a regular dental visit. Like, that's incredible. You changed people's lives with that.
It was great.
So that's amazing. Yeah, I love that. How do you stay updated on the latest advancements in the field, just to make sure your patients have the best care?
We do a lot of learning. We are constantly learning, and I'll let Kasia explain more of this one.
So we're both members of the Academy of General Dentistry. It's a organization for dentists, for general dentists only, which is great because they're focused on educating us. It's not just a general for all the dentists, So when you're a member, you can become a fellow of the Academy, and what that means is that you've taken over 500 hours of continuing education and passed a very hard test.
Wow.
And so I received my fellowship last July.
Congratulations.
Laura actually just passed her test.
Congratulations.
Thank you.
Yeah.
She still has a couple hours to complete, right?
I should be up next year. I should be able to
That's amazing. So, it kind of motivates us to always learn and not just take the minimum required to keep our licenses. Like, way surpass that in the hours that we spend. I'm learning a lot on Invisalign because I do Invisalign at the office. So I'm always taking classes from different professors, different general dentists who are teaching and who have lots of experience, because there's always tricks and methods of making it work really well. And then Laura is diving into sleep.
What do you mean?
Dental sleep medicine.
I'm like, I like that.
I know. We all need some rest. I know it sounds like cautious.
Did I mishear that? My tiredness?
Yeah, totally. No, there's this emerging field to help treat patients with sleep apnea.
Oh,
It's
that's
called,
incredible.
It's called dental sleep medicine. So we're working alongside the medical doctors too, the sleep physicians.
Right.
Who are conducting the sleep studies and diagnosing patients who do have sleep apnea. And there's various degrees of it, mild, moderate, severe. At really, the first line, at least for patients to try therapy, is usually the CPAP machine.
Right.
And almost everybody listening, I'm sure, knows someone or themselves have tried the CPAP and hate it.
Yeah, I don't think it's pretty.
Some people love it, some people don't mind it, but the majority of people do have a hard time getting used to it and wearing it. So if you're not wearing it, it's not helping you, and then you still have sleep apnea.
Right.
So something else really needs to help them at least be offered. So there is a dental appliance. It's similar to a night guard, but it fits on both the upper and lower jaws.
Wow.
And they can be linked together, and there's various designs depending on the patient's mouth, teeth, supporting teeth, and it brings the lower jaw forward just slightly.
Okay.
And that opens up the airway in the back. It pulls with your junk.
Amazing.
If your jaw comes forward, your tongue will come forward,
Yeah.
and you can breathe more easily. And sometimes that can
feel
be
like I have to
worn.
test this
Yeah. With the CPAP, that's called combination therapy.
Oh,
So
okay.
it doesn't have to be one or the other. Sometimes patients can do both. So I'm learning more about that right now. There's a mastery program from the American Academy of Dental Sleep Medicine I'm in right now. I'm almost complete with. And I just had a workshop in Chicago a few weeks ago that was very hands-on and was really able to collaborate with other dentists who are my peers who are in the same program and see these models of appliances and understand more how they work and how to design, how to make one that's really customized to the patient.
Wow. I didn't even know such a thing existed. So that's great. Does that, I'm trying to imagine sleeping with your jaw out. Is it still comfy still?
It's meant to be comfortable.
Okay,
And if it's not, then we have to work on it because you're supposed to be able to fall asleep.
I was going to say, because you need to be able to fall asleep.
Right. So
the thing is too, when you the device moves your jaw forward, but what's happening when you have sleep apnea and you don't have a device, you're actually doing it yourself, because a lot of people will start moving they will start grinding forward. And they don't realize, but what they're doing is just opening up their airway. But what we see in the mouth is a lot of wear on the lower teeth, and teeth are becoming very short. So it's very connected to dentistry too. It's
Interesting.
not, we're constantly seeing signs of it, and patients will, we'll tell patients, hey, you need to talk to your doctor and get a sleep study, and then they'll come back and be like, I have sleep apnea.
That's incredible to me that you can see that in their teeth.
We can see that in their teeth. We can see that in their mouth.
Wow.
The soft tissue changes in the back, and the teeth can change with wear.
That's amazing.
Yeah.
Like investigators.
Sleuths.
How are you getting this wear?
Teeth sleuths. Yeah, exactly.
Let's figure this out.
That's incredible that it's all tied together. It really does amaze me. So I geek out over this stuff. Kind of coming off business a little bit, I'd love to hear from each of you 3 fun facts about you personally. So whoever wants to go first.
Well, let's see. Something not everybody knows about me is I used to be a whitewater river guide.
Oh, wow. That's cool. Where? In Colorado or no?
Way back. No, this was way before dental school. I was actually in my summers off during college.
Cool.
Right after high school for a few years, 2-3 years. It was great fun. It turned from family trips and loving the idea of, this would be a great summer job.
Yeah. Oh,
I'm going to do something I love.
Yeah.
And help people. You're cooking, you're camping. That's not just day trips. We were camping out by the river. These were 4 or 5 day river trips.
Amazing.
And Utah was my main destination.
Okay.
Up by Vernal. Very small town.
Wow.
People are going to have to look it up on a map. But it's near Dinosaur National Monument, which is a great place. Lots of fossils and dinosaur bones are found in that area. And the Green River runs right through that area.
Amazing.
So good rapids. Let's see, another fun thing about me. I love ballet and dancing.
Oh, my
used to dance
kids are all
myself.
dancers.
Oh,
Yeah.
really?
Yeah.
I miss
My
it.
girls.
I miss it. And I love baking. I can make a pretty killer chocolate cake.
All right, I might hold you to that. Because I can eat a really good chocolate cake.
Yes.
That's amazing. I would love to hear more of yours.
Okay, so I love yoga.
Ooh.
I've been doing yoga on and off probably for 15 years now.
Wow.
And that, when I say on and off, like some years are more consistent than others. Like when I had babies, when we just bought the practice, obviously it wasn't as consistent. I'm becoming more consistent now. The kids are older. It's easier to leave them at home.
Definitely.
But I actually met my husband at yoga.
No way.
Yeah.
That is so, and remind me where you met him.
In Boston.
In Boston.
Yeah.
Okay. That's amazing.
So we kind of have that fun story of us meeting. I'm always reading.
Yeah.
I always have a book on Kindle that I'm reading, and it's usually like fiction, whatever's bestseller on New York Times. And then I always have an Audible book in my car because it takes me 30 minutes to drive to Santa Rosa every day. So I do utilize that time. If I'm not listening to your podcast, I listen to the book.
Thank you.
And then I love camping. So we actually fill our summers with camping to a point where I think at some point this past summer, there was not a weekend we were home.
That's amazing.
And so, but my kids love it.
Yep.
And I'm getting them outdoorsy
as
much as I can. So that's kind of,
Oh, I love that. And you're going to have to join my book club. I'm in a book club. You should come with us.
Yes. Absolutely.
It's fun. It's a good time for sure. So wonderful. At the end of each episode, I'd like to hear who you think really helped you in your career, if there's anyone you want to give a shout out to.
I would love to give a shout out to my parents. They first gave me the idea of becoming a dentist.
Yeah.
Because I was considering nursing or some job in healthcare, but wanted to do something more with my hands, and they thought, why don't you consider becoming a dentist?
Amazing.
So I did. And my husband was very supportive from the beginning. He and I had only been dating for about a year, maybe less. And I told him up front, I'm going to be applying to dental schools.
Wow.
So that could land me anywhere in the country.
Totally.
So fortunately became Boston, and he moved with me out there, and we weren't even engaged yet.
Wow.
So, and we became engaged while we were in Boston, and got married right after graduation. So thank you, Tom.
Oh, I love that. That's sweet.
Oh, boy. Well, yes, parents,
Yeah.
right?
Yeah.
I think from the beginning, my parents, growing up in Poland, like there wasn't a whole lot of opportunities at that time. And my parents always instilled in me, like, one, get your education, and two, if you don't try, you already failed. So don't be afraid of failure. Just try it. Worst case scenario, you fail, but you can't succeed if you don't try. And then Nate, like, yes, my husband. Husbands are so important, right?
They are.
But, he always believes in me, and he's always saying, like, you can do this, you've got this, and he's always got my back. So he always feels like the practice is almost like his. He actually does a lot for our practice. He's our, like, go-to guy when the computer's not working. So he's our amazing IT guy at the same time. So, just doing the business, being a mom, being busy, you can't do it without the other half.
Absolutely. So, yeah. And supporting you with that endeavor to have your own practice. It is a lot for everybody. So it's amazing. Great. Yeah. Oh, I love that. Where can people find you? Where can they follow you on social, if anybody's interested?
Laura's looking at me.
Because you handle all the social, and by the way, it's really good. You do a very good job.
Oh my God, thank you. I'm very self-conscious on the camera, so like whatever reels you see, it took a lot of guts to not only record it, but to actually post it.
Well, they're entertaining and definitely good. So.
So we have Instagram. We're just at Santa Rosa Dentistry. Same with Facebook.
Great.
And santarosadentistry.com is our website, so you can get more information there. We are on Sonoma Avenue, so you can always drive by and stop by, say hi.
And are you taking new patients right now?
Absolutely.
Great.
Yes.
Okay, wonderful.
We love new patients.
Wonderful. Oh, well, thank you both for joining me. I loved hearing about this. It's such a different field for me to hear about, and like honestly, not one that I pay like as much attention to. Like I was saying, I just go to the dentist, and it's one more thing on the to-do list, right? And so it's so interesting to hear more about this, and I really appreciate you coming on. So
thank you very much. We had fun.
Super fun.
Great. Thank you. And thank you for listening. If you like what you hear, please be sure to like and subscribe, learn more about Sonoma County and all that we have to offer here.